Hi, everybody, and welcome to a new episode of Mrs. Pinky Thoughts. I am your host, Nicole Pinkston, and I'm here today to introduce you, Mrs. Nikki Johnson, who is also an MD, and she's on Twitter and stuff. How are you doing today?
I am doing very well. Try to do too much in one day as usual, but other than that, I'm doing great, and I'm so excited to be here. You just don't understand it.
Oh, thank you so much. Before we get started, I just want to ask everybody to please like and share this YouTube so we can get more voices out there. We are part of the Conscious Conservative Media.net, which is down in the middle, and I have all of my shareables and pluggables all around the video. And I would like for you to also hit a like and hit that notification bell so when I do drop another episode, you guys will be ready. Thank you so much for joining us. Today, our chat is about healthcare, and we're going to talk about just the healthcare system in general and all the issues with it and what the progressives are pushing and what the GOP pushing. And I have my special guest here who is way more knowledgeable about this than me. How are you doing today? Can you tell everybody about yourself?
Yes, ma'am. Okay, so I am a doctor of medicine. So yes, I am. My full name, Nicole Johnson MD. So we are both Nicoles and we're both Nickies. But you can find me on Twitter at Not a Provider MD. I am a pediatric intensive care trained physician, but I operate very closely to what an anesthesiologist does. But my main voice out in the public space on social media is mainly about healthcare advocacy, advocating for patients, advocating for physicians, and mixed with a lot of bit of politics. So I just like to have fun on Twitter, but I also like to educate, and I like to have conversations about solutions. That is where I live. So I got started doing advocacy. I'm going to give you this background first before we talk about what's going on in the healthcare stream. So I got started doing this stuff, getting on social media, getting in Facebook groups with other physicians, and women and men. We just sit around complaining about stuff, about what's going on with medicine and what's wrong with it. And people were just doing a lot of whining. And I'm one of those people that's like, I need to get going. I need to fix it. I don't want to just sit here and whine. So I reached out to a few people that I had noticed who were actually out there actually doing things to make some changes to the things that we were complaining about. We all have very similar complaints. Not everybody had the same solutions for doing it, but I really wanted to get active. So I got connected with people who were active, who actually had solutions, but were like really active, going to lobby, learning about all the problems and the background of everything, and then trying to figure it out. So years of doing this got me connected to lots of people, obviously now, who are doing this type of thing. And now I am a founding member of a coalition called Free to Care. The website is free2care.org. It's the number 2 in there. And it is made up of a coalition of multiple grassroots organizations that are physician-led, some are patient-led, some are sort of businesses, are in the mix of it. It's just a huge mix of people in the grassroots arena. The majority of them are self-funded units. So, and I also founded an organization called Physicians for Patients, our website, plugging the HTTPS at physiciansforpatientsofficial.org. We are specifically focused on increasing the physician shortage after we've seen the government have ideas that are replacing physicians instead of actually increasing physicians and patients' access to physicians. So that's kind of how we started. Our organization ended up being a founding organization with Free to Care. So that's where I am. And that's how I found out all of the stuff that I found out. So most of us sit around complaining about things, but we have no idea how it's formed, why it's the way it is. We don't know anything about the legislation. We don't know anything about policies that actually cause the things that we're seeing every single day. And so getting involved, connecting with people who are actually doing this has opened up my world, and it's just something I strongly advocate that everybody does. If there is something that interests you anywhere, politics or whatever, find out why it's the way it is, and work with people who have solutions. You may not be able to lead an organization, but you can help. We need bodies. We need people who are doers. We have the idea people. We need the people who can help execute it. So that's where we are. One of the things that I found out just in the last few years of doing this are there are two major kind of rules. Is there are two big changes in healthcare policy that have led us to the point where we are right now. The point where we are right now, so that we're all on the same page, is we have people who are not insured, people who are insured, but still paying loads of money, thousands of dollars into the healthcare system, and still not really getting everything that they need. We have people who have to wait in line to see a specialist. We have people in rural areas or communities where there is no physician or the like around to be able to get them the medical care. So we have access problems, we have gaps in that, and we have so many corporate entities involved in making decisions, along with government and politicians making decisions about how it goes. Those people are actually profiting off of it, and the patients and the doctors are left out of it. We don't really have that voice in the policy making. So one of the biggest changes that happened over now 30 years ago was when managed care entered the picture. And just kind of a simplified way of saying that insurance basically began to dictate who you got to see as your doctor, which hospital you went to, which medications you get prescribed, which tests you can get, where you can get those things. That's the insurance piece of the picture. The second piece of this is hospital. That piece led to everything else is where we are right now. Think back to probably a time when you were growing up. If you had to go to the pediatrician for something, or you got sick, your parents took you into the doctor, sore throat. Do you remember your parents grumbling about insurance or costs of anything? And I'm talking like 20, 30 years ago. There wasn't a lot of that. But now that's what people are concerned about. It's the cost of it. We didn't have to worry about that because we had a lot more choices in the matter. We could choose which doctor. We could go to the doctor down on the corner. There was a practice there. More than likely, there was somebody there that we considered our family doctor that we went to in our neighborhood, and every neighborhood is different. So I'm not going to assume everybody had the same experience, but it was more about the connection and the time you spent with that physician and the nurse, you knew them all. You know, you got your sticker or your balloon when you were done, and then you went home. You didn't worry about the bill because you know it was paid right then and there. You weren't worried about what insurance was covering and what they weren't covering. Um, so managed care enters the picture, and that has become the centerpiece of it. Insurance dictates pretty much everything right now. There are people like me who don't even like to use the word insurance. I call it a healthcare plan, because that's really what it is. You have someone who gives you a gives you a package with choices that you pick. You pick, you know, option A, where you're spending a high deductible, but you don't have any copays when you go see the doctor, even a specialist. The other plan may be something kind of a mixed in there, and then the cheaper, lower deductible plan has you paying a lot more upfront. Like, say you're having that copay when you go see the doctor, and so that is pretty much the same kind of package you're going to get no matter where you are, no matter how you pick your insurance. The majority of Americans are getting their health plan from an employer. You leave that employer, you have to pick a different health plan.
So they don't I'm sorry. So it doesn't transfer over no more? It
No,
doesn't
so
carry over, or there's no carryover insurance, or is that
there is no, exactly, there is no portability with it anymore. So you can't just say I'm a Kaiser patient and then I go pretty much anywhere a Kaiser doctor is. You know, that's just what I want. You, if you change your employer, your health plan then changes. So now we have, so the issues that people have, there are people in the middle making the decisions for us. So you got middlemen making decisions between you and your doctor. You have them making decisions about where you go to get your care. You have no control over where you spend your healthcare dollars. And you don't have portability with your health plan. You can't take it with you. You can't just package it up, leave the state, leave the, I mean, like, just go down the street and join a different corporation.
So you're saying that we have these middlemen, right, that are creating this corporatism and for profit, or these government people who are getting in the middle between us and our doctor that are creating problems of the healthcare system that everybody is complaining about. So
Correct.
You know where I'm going with this question is,
Correct.
Then why would we increase the size of the middlemen to try to fix the problems that we see with the healthcare?
Exactly. So the worst thing that we can do is increase middleman, and then make the government a bigger part of the middlemen per se. And so right now we have probably about believe it or not, people don't really get that the more than 50% of American insurance coverage or healthcare coverage, third party payer, there is some government in the middle of that. Medicaid, Medicare, they dictate the cost of medications, they dictate the cost of treatments, because they are sort of the standard that everyone operates up against. The Affordable Care Act, which I call the Unaffordable Care Act, put more of that in. They put more of the government in the middle of things by expanding Medicaid. It also introduced loads of regulations that are required for your physician's office, your hospital, wherever you go, to have to participate in and have to basically check boxes to be what they call an accountable care, organization, in order for them to run. So you have seen, not only because of Affordable Care Act, but also because of managed care, you have seen a just a gosh, I can't even figure out the word of it, but just like a viral plague like covering of America with large health systems. You see what once was just a hospital where you went to, now buying up every single practice in the community, in the state. I mean, they're branching out as far as they can go. So you are seeing fewer independent practices. You are seeing larger health systems. This is all because of government rules and regulations that have interfered and made it more difficult for private physicians and even non-physicians who own practices to actually run and operate that practice. A larger health system has a bigger infrastructure, so they can have a team whose job is just to make sure the hospital is meeting all the regulations.
Okay, so I have a few questions, some from people that are commenting and some just for myself. My very first question is back to when you were describing insurance as a health plan. When my husband is a government employee, though, and we had to go into his government insurance, even as a government employee, there were like 3 or 4 or 5 different plans. And I'm not going to lie, it was confusing to figure out if I pay a deductible when I go to an appointment or do I pay a deductible after I go to an appointment. And I honestly just juggled what our monthly payment would be because they were all confusing when it came to that health insurance. A lot of Americans, we don't grow up learning how to actually get health care. We learn either we get it from our employer or we stay on our parents till we're 26, or we just wait until we break something and then we just try to pay the bill when we get it. So you're saying
that's by design.
After 30 years, the government did that. So we have a president who is 78-ish, I think that's his age. And he tells a story about his dad sitting around the table worrying about health insurance costs and things like that. But I'm like, wasn't he born before that all took place? So did he have a direct more access to healthcare? I'm not saying it wasn't hard back then because he's old enough to be back when it was other things going on and his parents had to juggle that. But so like just from my own personal experience, like I was in the military, so I had TRICARE taking care of everything. And when you are soldier, basically the military just does everything for you. So when you become a civilian and get out, then you're thrown into trying to figure this all out by yourself. And so I want to interject that I did try to go on the exchanges, and I did, even as a conservative, say, you know what, let me look and see what's out there for Obamacare. And they tried to give my family of 3 at the time an $1,800 something from the bronze plan. And I was like, I wouldn't even go trying to like slide Obama or be like, I'm conservative, I'm just going to ignore it. I actually went on the exchange to try to see what they were offered. And so when I went onto the regular Georgia-based state website, it was all of this. Blue Cross Blue Shield is this. Kaiser is this. Wait, but Kaiser is not in our town. Our town's little. Then you might have these 3 doctors. It is confusing. So why would anybody not say, let's just streamline all of it, make it all free, and just let the government just say everybody can go anywhere and just have free medical? So as you explain, why no to that, I'm going to look through the comments and see what other kind of questions we have popping up. You can answer some of their comments too.
So I mean, that is a great question. And that is one of the reasons why Medicare for All is a winning message to people. It seems so simple. It simplifies it. It just says, hey, let me take all of this confusion away from you. Let me take all of these decisions away from you. And just make it easy. You go to one place. You got one place to pick from for your plan, and we will take care of everything. You'll have access to a doctor. You'll have access to a hospital. It'll all be paid for. It'll all be covered. So it sounds sexy. It is one of those things that it grabs people. But this is the part where conservatives suck.
This is why I put up Jeff's question, because I knew we were going into the solution part, because we're both solutions oriented people.
So
Mhm.
they are awful at messaging, and I have been behind the scenes for quite a few years talking with both sides of the aisle about healthcare. Let me start here. The solutions to healthcare, they're not conservative, they're not progressive. They are common sense. And um, because we have so much kind of corruption hidden in the web that makes up this big, what I call the big healthcare cartel, people don't people don't know that we need to break that down first in order for us to get to a point where we are able to lower the cost. The things that people want: lower costs. They want portability of a health plan if they have a health plan. They want to be able to pick and choose their own doctor or hospital that they want to go to. And they want to be able to get the medications and the imaging or tests or whatever the doctor prescribes them. They want to be able to get that and not have to sit there and negotiate with a pharmacist or an insurance person to be able to make that. This is actually information that is known from market research. I can at some point during my podcast, which is starting on Friday, I will go through some of that and actually give the details of this actual market research that one of our organizations actually did and picked over about 25,000 people, all demographics, all age groups, all backgrounds, all ethnicities. And those are the things that people want in their healthcare. So you will ask them, do you want Medicare for all? Most people are going to say yes. But then when you break down what it is exactly that you want, that then you get that list of things. And none of those things will be allowed in a Medicare for all plan. So everybody wants the same thing, but now conservatives need to sell a message to get all of these things that they want.
Have
So
you heard it?
solution
Have you
one.
heard a message? Like, that's what Jeff's question is
Yeah,
basically
yep,
asking.
I'm
Have you
getting there.
heard it? Oh, okay.
I'm giving you a roundabout way.
Oh, this is
So
complicated, so it's okay. You
yep,
go
yep,
whichever
yep.
way
So
you
we've
need to
been
go.
working behind the scenes, trying to get the Republicans to get a message, and we have been meeting, oh, gosh, like exhaustively over Zoom with some lots and lots of people who are policymakers, who are legislators,
Yes.
and many of them get it, but the powers that be are keeping
It's funny.
conservatives from making a cohesive message. That's number one problem. Problem number two is they're afraid. They have no idea what they're talking about half the time. The ones that do don't really have the loudest voices. So um, so here are things that we think we were able to sell some of these ideas to Trump in his late rollout of his healthcare plan back in September of 2020. A lot of these ideas were laid in there. It was not packaged in some huge 5,000 page bill. And so people thought, okay, this isn't a plan. But because there's so much corruption and so many players in the mix of things, I mean, I'm talking insurers, pharmaceutical benefit managers or PBMs, group purchasing organizations, American Medical Associations, AARP, they're all in this together to
Mm,
profit and make money. So we have to figure out ways to actually take those people down, because medical care is not expensive. That is if no one else takes any, if you don't take anything else away from this today, medical care itself is not expensive. Going to see your doctor, getting medications, those things are not as expensive as it's been put out with an insurance plan on there. So how can we make it make people understand that? One, it needs to be it needs to be transparent. So we need to expose a lot of the corruption. So just for example, I mentioned the pharmacy benefit managers and the pharmaceutical organizations. Pharmacy benefit managers are organizations that are supposed to negotiate lower prices for you with your insurance company. So they make these deals with an insurance company to negotiate lower prices. So they sit down and then they pick, which doctors you see, which medications go on the formulary, all of those things, and then how much they cost. And they're making these deals with the pharmaceutical companies. But which is great. It sounds like it's a great idea because you do want people who are negotiating on your behalf and doing that job. However, it has gotten government in about 30 years ago gave there's a statute that allowed these pharmacy benefit managers and group purchasing organizations, by the way, to get kickbacks, and they have a safe harbor from it. So basically it's basically money laundering. So they negotiate this contract. The contract is secret. We're not allowed to see it. It is completely opaque. And when they negotiate, they get a certain amount back from what the insurer sells, and the insurer gets a little bit of a kickback in there too. And the pharmaceutical company all gets a piece of the pie. So you started seeing prices on drugs skyrocket because in order to get a bigger piece of the pie, they had to make the prices go higher for the consumer. So whenever you hear the word rebate, you're not getting the rebate. It's them that's getting the rebate.
Wow.
So just for example, insulin. Regular insulin now can cost on a healthcare plan $1,200 a month. Somebody just tweeted this out to somebody, they were behind someone in line picking up their med, and that's about how much it costs.
Wow.
A vial of insulin for 30 days that you can get from a wholesale purchase through your doctor directly or a local pharmacy, $25 a month. That change is because of PBMs. And so if we can make number one, spread some sunlight on these contracts, and also take away their safe harbor, that is projected to actually lower the cost of medicine for Americans somewhere in the to $20 billion range. I mean, that's ridiculous, right? Like, would you think it would just be so easy to just do that? Well, a physician I work with wrote a single page bill, wrote out the bill himself and presented this. President Trump actually presented it in the Rose Garden early in 2017. And we couldn't get any congressman to bite.
Did we have power in Congress, and did we have power in the Senate?
Yes, we did.
At that time too. I'm just asking because I wanted to make sure I was right about that. I might have, had a memory lapse, but I swore we had the whole thing.
But the kicker here, though, Pinky, is we introduced that bill to both Democrats and Republicans.
To both sides.
Both sides are in the middle of this. This is why I say the solutions to healthcare are not conservative or progressive. They are nonpartisan. They are simple, common sense regulations and policies that just need to be exposed. So that's one. So that's one. So that's lowering the cost of medications. People, these specialty pharmacies, if you have chronic medical illnesses like I do, I have to order one of my medications from a specialty pharmacy. They have to deliver it, all of that. That increases the price of your meds as well. So you're having to use one particular pharmacy. That's all part of the big web of secrets. So that's one of those things too. If you go and see your doctor that is part of a large health system, you don't necessarily get to pick the person that you want to be your primary care. You have to pick, have it. They suggest for you who is the first available, who is this person is open. This person is not accepting new patients. Well, if you decide that you don't want to use your health insurance and you want to use, a lot of people call this concierge medicine, but it technically is not. There's kind of two versions of it. Direct primary care, or DPC, are physicians who actually do not take insurance at all. Some of them have opted out of Medicaid and Medicare. And
Wow.
so patients actually will contract with them a monthly fee. And for that monthly fee, you get as many visits as you need. You get, these doctors are making house calls. They are making, they'll come and see you, or talk to you off hours of the day. I mean, it's like you have your own personal doctor, and some of the rates are as low as $50 a month. I mean, that's cheaper than a cell
What?
phone. That's cheaper than a cell phone bill. And then in many states, some of these direct primary care doctors can actually dispense medications straight, like have right from their office. So they order them in wholesale, and they have the right to dispense them, or they refer you to a local pharmacist, not your CVS, not your Walgreens, kind of generic mom and pop local pharmacist, where they can negotiate for you a cheaper price. The same thing with imaging. I myself had an MRI about a year and a half ago, and I decided not to use my insurance because the MRI machine at the hospital where I work, in order for me to get it there, was just the machine, and the time that I'm on the machine is $3,500. I went and got my MRI at a private imaging group, a company, and paid out of pocket $350. So 10 times less, just going to get it that way. And how I did that with my healthcare savings account, which brings me to another point in this. Americans want control of their healthcare dollars, right? So if I pick a high deductible healthcare plan that I want, if I want to stick with having insurance, pick a plan, or I just decide that I want to open a healthcare savings account. It is tax-free money that you can use on your medical needs, all your healthcare needs. There's FSAs as well, but right now, in order to get a healthcare savings account, you have to be signed up with a high deductible healthcare plan. You can't just go and open up a healthcare savings account. So if I had just a healthcare savings account, just like, you could go grab a Roth IRA from anybody, you could go and spend that money anywhere you want it. But right now, there's regulations in there that you can't just go and open up an HSA. So that's the money that I use to go and get my my MRI. And so for someone who's healthy, who's single, or even married with like one or two kids, you can save up a decent amount of money, from each paycheck that you get. And if you're healthy, you're not using it all the time. So that money is just banks and rolls over every year, and it's tax-free money. And so if you need something, if you get sick, if you need some, kind of emergency care, that money is there for you to use. And not everybody has that. So you do need other options. And so direct primary care, a lot of these healthcare sharing ministries, there's so many innovative ways to cost share medical care these days. I haven't found one of those plans that works for me, but there are people who do that, and there are people who have sort of a combination of things that have made it a lot easier for them. So they will get a health care plan that has a high deductible, keep that for their kind of like emergency use, because right now you're not allowed to just get a catastrophic plan anymore, that thanks to the Affordable Care Act. And have that just be your plan, and then save up your money and go pay for your preventive care. the way you want to pay for it. So that before the ACA, you could do that. And that for some people was really worth it, because if they didn't have chronic, medical illnesses, they had that backup for if they needed emergency care or they developed an illness and they needed to get treated. So, so there's just so many innovative ways. And one of the things, this is actually one of the topics that I'm going to get into specifically on my podcast that'll be airing first time this Friday,
It's Friday,
at 8 p.m.
put that
Eastern.
information in the show notes when I get finished, because
Okay.
a lot of people are saying we got to have you back. We got to talk about healthcare. Is a big talking point.
It's a big topic. So I'm going to try and have some good content every week.
And I'm going to be there
to cover kind of all of these issues. And it's going to be focused kind of on the solution. So a lot of these things we have brought obviously to legislators. So
if you have brought ideas to it, you actually had a bill, you actually try to get it in both parties.
So and that's just one bill.
To make that clear that we are solutions oriented. We're not just out there with talking points and just pointing and complaining. We're creating organizations. You're creating this podcast. I have my podcast. We're actually out there trying to fight this, but it's a almost a Rubik's Cube that we're trying to break open.
Yes.
When it comes to healthcare, with it's set up and designed this way.
Yep. And so it is, I mean, a lot of it is designed that way on purpose, because there's a reason why you said it's difficult for you to figure out even which health plan to even purchase, right? There's a reason why it's difficult. There are people who don't want you to know how things work. It's difficult for me to understand.
And you're a doctor.
And you have to, and the other thing about it is physicians, when we go through training, we get trained on how to prevent disease and how to treat disease. We don't get training on how the actual healthcare system works. So a lot of the stuff that I've learned all came after obviously training and starting to practice. We're spending our time away from family, away from, just like living a life, going through all of this training. And we just want to practice. We just want to take care of our patients. That's all we want to do. And so the same things you guys want as patients, we want too. And so we're on the same side. So advocating for us is advocating for you as well. So it all goes together. So I just want everybody to know that 9 times out of 10, you ask your doctor why you only spend 10 minutes with me or only 15 minutes with me, and you really don't address all my questions. Well, there are lots of reasons for that. And yes, there are some people who are out there who shouldn't be practicing medicine. I am the first to say that those people exist. I know that, but for the most part, we care and we want it to be better for you. We want the cost to be lower for you. We don't profit from this for the most part. I mean, like, there are people who do, who don't practice as much clinical medicine. They work maybe for a pharmaceutical industry and, do a lot of research there and maybe get paid for that. Nothing actually really wrong with that, but there are people definitely who are in it for the money. But most of us want to care for you. We want to prevent illness. We want to see our people thrive. We want to see our people healthy. We don't want to create these vacuums of, these pockets in a 2-tiered medical system. We don't want that at all. And that is what Medicare for All is going to do. By the way, there's a limited number of us. Even if states with the Affordable Care Act has expanded the scope of practice for kind of allied health professionals, your nurse practitioners and your physician's assistants, they have done that to allow people to have more access to medical care. But even still, those numbers are limited as well. So there's only so much of us to go around. There's only so much time in a day. If you're requiring, if you're having to pay us all and having us to see 10,000 patients a year or whatever it is, there are going to be delays in care. You think Americans want what they want right now. We are a fast food country. And for people who think, let's just try this, let's just do it, other countries are doing it. Well, other countries don't have the number of people that Americans have and are doing these plans. You look at Canada, people always point to Canada. Canada does not have the same population that we have. So that's not doable there. And so there are only so many resources to go around. We saw this in the pandemic early on. Remember when we saw medications were getting shorter? We saw PPE. You guys couldn't wear surgical masks because there weren't enough for us in the hospital. There were hospitals who were rationing the masks. We were even wearing cloth masks in the hospital in order to ration them for the surgical patients or the anesthesiologists who had to intubate these, and the ICU people who had to intubate these patients with COVID. We had to ration them as well. Why? Because not because of the US government per se, not because of Donald Trump not having a plan, because the contracts that are created between hospitals and group purchasing organizations have decided that they go with the cheapest manufacturer. And once you contract with them, you don't go anywhere else. So guess who the cheapest manufacturer was? China, just like Amazon. And so we had to wait until China said, oh, okay, we'll give you some more of these. Instead, you saw Donald Trump deregulate. People were getting their care by telemedicine. Companies started manufacturing PPE in the US and it exploded. But what did the hospitals do? The hospitals temporarily took some PPE from these manufacturers. But as soon as China was back online, our PPE boxes you started seeing made in China came back again. Why in the world would we do that? Again, contracts, no transparency, and just corruption everywhere.
I got a good question for you now. So you said that the system is designed this way to be complicated, to be expensive. So would you say this was a systemic problem? Could you say this is a form of systemic racism because poverty-stricken communities typically are minority based?
Absolutely, and the lesser educated.
Lesser work, system set up, more health issues, but not the money to fund them.
Exactly.
So when people are out there saying systemic racism isn't a thing.
And higher medications, insulin being a huge one.
Like I can give you my own family history. For example, we have high blood pressure, heart disease, diabetes, cancers. I'm struggling with my weight, overweight problems. I need glasses. And I'm just saying that because some people are going to hear the audio. But I'm saying that's just from my side alone. I didn't even bring up my husband's side. And then my kids have allergies and diseases, ADHD, medication. I'm a veteran as well, so I have issues with that. So when people say there isn't systemic racism and you happen to be a Black woman that is also practicing medicine, do you think that that's when people are complaining that the system is racist? They're not saying that America as a whole is racist, but there are certain things in place that stacks it against,
absolutely. And there are things that are stacked up against our community for sure. I mean, I gave you the example of my mom. My mom, with the insulin, my mom has diabetes. So an insulin, she could attest to the price of the insulin skyrocketing. Ridiculous. I mean, she would actually forego or ration out her insulin because of that. That is insane. Nobody should be doing that. So, and definitely in our population, Black Americans, all the things you listed, high blood pressure, diabetes, high cholesterol, obesity, huge. And if you don't
get that confused and think, well, it's just targeting us because we're Black. And you're like, no, it seems that way because we have all of these pre-existing kind of things. have more poverty. We have more
Correct.
health issues. So since the system is more classism, where these corporations and the government is trying to make more money, they're going to be it's going to seem like they're targeting Black people. And so, but that's how it's going to play out.
Right. And so, I mean, yeah, and that's just on the treatment side of things too. Think about that. That's just the treatment side of things. The preventive care side of things it's almost like an afterthought. One of the things that the Affordable Care Act did get right was they just went around or about it the wrong way, was encouraging people to get a primary care physician. I hate the word provider, but healthcare professional for primary care, to kind of somebody you could pick to help you be your well self, because the people who do that catch any diseases earlier, but they also work to prevent illness. And there are people, the internet has made it so much more possible for people to get exposed to ways to stay well and healthy, which is fantastic. But people do rely on and trust their physician and their nurse way more than they do the internet, believe it or not. And so it is necessary for people to be able to have someone that they can call a primary care health professional they can go to and rely on to help them actually stay healthy and prevent these diseases. So this whole complex, going back to kind of the creating the disparities, is because insurance has become such a big piece of this, and all of these non-transparent pieces and parts of it, you don't get to spend that much time with your primary care, professional at all. It went from when I started my training over 20 years ago, we had 30 minutes, sometimes 40 minutes for a new patient to come through. Do you know what a new patient slot is now? It's 20 minutes. That's ridiculous. It's insane. You can't get to know someone and all of their healthcare needs, and help them prevent illnesses.
I can't get to know you if I want you to be my doctor
20
either.
minutes.
Just sitting
Some
there
cases,
in 20
15 minutes,
I'm
right?
out.
Right. And that first impression, I mean, I can tell you, there's myself, I walked into doctor's offices and I'm like, I'm not going back there. Just, because that's all I get from you. I'm not going to do it. And so what incentive is that for anybody else to want to pick someone and continue to go to that practice and stay healthy? And so tinfoil hat off. I mean, like I some of the stuff is designed
Yes.
I think the problem is really that a lot of this is crony capitalism, obviously,
Yes.
which is bad. Capitalism is great. Crony capitalism is not. So
No.
all of these entities getting together and profiting off of patient care, it's working for them. It is not working for us. And I think their bottom line is money. Their bottom line is profit. Our bottom line is care, not just access to care, actual medical care. And
yes,
so
people get the two mixed up. They get insurance and access to care mixed up with actual quality of care.
absolutely. You can, you could have a, like you said, $1,800, premium per month. And then, I don't know, $8,000 deductible or whatever. I'm just making stuff up out of the top of my head. But okay, is that gonna, because you have such a high deductible, are you going to the doctor when you're healthy? Probably not. You're probably gonna wait until you're actually really sick to go. And even then, people will go ahead and just go to the emergency department.
Well, if we're juggling, just getting out of a pandemic, we're juggling just getting our job back, and we just got a new job, so we don't want to take time off.
Yes.
Or we had kids,
Yes.
we have little kids that got
Yes.
older. People have to make these choices of whether or
Yep.
not, like, for example, I've paid co-pays. Every time I go, I got to pay this copay. So if I'm deciding whether this time is it worth it, I'm like, do I got the copay
Right.
to pay that?
Right.
So people could be playing with their medical care because they
Exactly.
are
You
living
ration it.
paycheck to paycheck.
Right. And if you ration it now, you're going to ration if the government is covering it and controlling everything. But going back to kind of the solution part of this
Yes,
is,
let's get back to
um,
the
so
solution.
we talked about cutting costs of medicines. We talked about getting people, a little bit more portability with their healthcare dollar. Um, eh, we did not talk about choices, like people having choices and being able to have some ownership of their own healthcare decision making, and also, getting physicians in a position to be able to practice and offer you the kind of care you need. Deregulation is huge in this area, and what we saw during the pandemic um, was one of those um, examples of where taking government steps, layers of bureaucracy out of the picture helped people to get the care that they needed. We have been advocating for telehealth to expand, especially in rural areas, which requires actual infrastructure. Anyway, we have been trying to get that to expand for a really long time. The problem that we've had from the physician side of things and the independent health practice of things is insurance reimbursement. Insurance, because most people are on a healthcare plan, including Medicaid and Medicare, they don't really reimburse telehealth the way they would a in-person face-to-face visit.
Mm,
Now,
that's interesting.
yeah, and reality is the only difference is you're not laying hands on the person. Now there are some like apps and programs out there that can do like a virtual examination,
Okay,
that
we
type of
can do that.
thing.
Mm-hmm.
You can get like a a tiny microscope that goes into the ear and then look in ears to see if a kid has an ear infection, look in the throat, things like that. Have the patient, take their blood pressure and it uploads to your computer, whatever. There's lots of things out there. And, you know, if telehealth or telemedicine was able to advance unrestricted, you'd see a lot more innovation. But because it's been so regulated, it has not been it's not a lucrative part of the practice for people to go ahead and like kind of spend the overhead on if they're not really going to get the reimbursement for it. It's awful that it's that way. But it is a fantastic way to get people access to great care. Even if you just have a primary care, professional taking care of you, go to that person. You need a specialist, dial up the specialist right there while you're there at the visit, and or schedule that appointment. And that's where you can meet the specialist who might be a state away, but at least they're able to see you and engage with you and get you the care that you need. So that is during the pandemic. We actually saw the Trump administration roll back regulations that prevented people from actually using telehealth in a way that they took away some of the liabilities, because there are some things you can't do on telehealth that you can, and if you miss a diagnosis, then that comes back on you. So that helped a lot. That is something that will need to be ironed out over time. Does it mean the government needs to decide on it? I don't know the answer to that, but my answer with government and anyway is always,
So do
as
you
little as
know it?
possible, stay out of it. I want to keep people safe and not be harmed by
Yeah. So we have
doing
to
this.
juggle maybe some telehealth, some in person, maybe
Yep.
something, some duality like
Yeah.
that. When we have more options, maybe we can, like, I can come sometimes in person, not
Absolutely.
for
Yep.
every appointment, or maybe I
Yep.
can see you more than once or twice a year, and you don't even remember who I am because it's a whole new year.
Correct. And the other part of deregulation is they suspended some elements that are now necessary, or what I call the checkbox medicine part of regulations, that in order to get reimbursed for a certain thing, you actually have had to do this particular one thing, like say you needed to take a temperature on every single patient in order to get reimbursed for the visit, even though the visit had nothing to do with a temp, like, right. And so there are things like that. And there's like over, 100 regulations that were introduced just in the Affordable Care Act that made it very difficult for physicians to practice in an independent practice. And if you can take away some of those things that are completely unnecessary, they are not keeping patients safe. It is just a matter of a third party payer deciding that they think that it's necessary for you to do.
So how will we go about doing that now? Since we've had Trump and we went back to Biden, who was also VP under Obama and helped push ACA, and everybody got their hand in the pockets. How will we put pressure now? Because, people want to win elections from now to 2022. We want to flip the House and flip the Senate, and then we want to win the presidency, obviously. What can conservatives do today to get that congressman to bring back that legislation? Exactly. How can we sell it to people that Medicare isn't good? Like, what can we do?
Follow me on Twitter. Join my, subscribe to my podcast when we start. And
definitely,
when we introduce you to these ideas, put it
up on the network.
You need to call your representatives. Some of these are statewide legislation topics. Some of these are federal, but call them, flood their offices. And I tell you, this stuff works. It really works. Our organization, Physicians for Patients, what we do is we stop some scope of practice legislation in states. And the way we do it, somebody lets us know in their state that there's a bill on board that's even like just in discussion in a committee in the state legislature. We get all the phone numbers, email addresses, we call in mass, and then bills gone. Like, it works. The left knows how to do this very well.
So we got to do it too.
As conservatives, we need to do it in a way that the way they do it. We really do. We need to adopt some of those practices. They have these text services, which is like, it's crazy. I'm blanking on the name of the one that I use now, but if I figured it out, I'll tweet it out later. But it's this one where you just go in and you just type, it's an account. You type in whatever it is you want. You just say, write a letter or whatever, something like that. Then it says, okay, how can I help you today? You type in whatever letter it is you want to, thing you want to say, few sentences, whatever, to your legislators. When you sign up for the thing, it actually asks for your address, all that, so it knows who your state legislators are, your governor, all those people, your state U.S. senator, your U.S. representative,
awesome.
And obviously the president of the United States. And what it does is you can, and then it'll ask you. You type your message in, it'll ask you who you want it to go to. They do the greeting and the closing for you, and it's gone. It goes, and it can go by fax or email, however you want it, or they can even connect you to the phone number where you talk right to your legislator right then and there, and leave messages. You don't have to talk to a person if you don't want to. Call at 5 a.m. when you know nobody's going to be in the office and leave a voicemail message. That helps. Really make the voicemail box full.
I'm sitting here because I have another way, but I'm waiting until you finish. So I am the executive director of the Conscious Conservative Media, and I've seen you hashtag conscious conservatism. So I feel like we got a conscious conservative person in medicine now. So I'm just like, can the network count on you? We can hook up. Absolutely. And now you're like one of our partners, and you can partnership with us. And whenever we have, like, we're trying to push, like, I have phone numbers of Georgia Republicans, and I can say, oh, well, Georgia's having a problem with healthcare. Maybe I can get some policy ideas from Nikki over here, and this Nikki can get it to, the legislators over there, and then we can start actually dismantling some of the problems we have in statewide
Absolutely.
Our district.
And that's what we do too.
Put it on the floor.
We share legislation that has solutions. You see somebody who had it and did it well, look it up, read it, and get it duplicated. Call your legislator and say, hey, this worked here. This is what I like. Can you please make this for Ohio? Because that's where I'm from. And then that's how we do it. We spread the word and flood them
Or maybe
social media.
I can get Felicia to come out there, maybe speak to some people out in Ohio about conscious conservatism. And you've already a member in the network, as Greg was putting in the comments.
Yes, there are
so
many.
we already doing it with partnerships. Like, I love it because what I was trying to
many connections we can make.
What I was trying to get through, because every guest I have on my show, I know the flip side of some of the topics that we're talking about. That's why I kept asking you about socialized medicine. And that's why I asked the last guest, Nina, about her being with the Libertarian Party. It's because we are up against battlefield of ideas. Absolutely. We know that they're going to use the idea of systemic racism to push socialized medicine. But when I say that systemic racism is in medicine, the answer would be to break down the system. It would be to deregulate, to shrink the system. Our answer of conservative principles is to destroy these systems that are in the way for Americans to succeed. See, a lot of people are thinking so shallow, and that's why we're not winning on the battlefield of ideas. When I'm saying that it's systemic, it just means that this is something that we have to use conservative principles of lesser government, lesser government, not more government to go in and try to fix what more government messed up.
Right. So and it's a language thing, just like you said. Use their language.
Use their language. Yes. So they're saying that systemic racism is attacking our community. Yes, it is. And systemic racism is making it harder for us to have good health care. Yes, it is. And who is it? It's the crony capitalists that are taking profit off our health care. So what are we going to do? Deregulate. Who's going to do that? You think Democrats are going to deregulate? You said you brought it to both sides. So there's progressives, Republicans that we've been attacking on social media that want to run and use government. Progressive Republicans. That's why I pointed out that we had 2017, 2018, we had 4 Republicans who said they was going to defund and replace Obamacare. And I know I had Jeff in there to ask the question earlier, what was the conservative solutions? But it's okay. We conservatives, we're going to come with some solutions this time.
I will tell you, one person to watch is Chip Roy in Texas. He gets it. He really gets it. Like, he's one of the people that I can honestly say, that I don't actually have to go and tell him all of these things. He gets it, because the people who are some people that I am working with in coalitions with have met with him over and over. He's also been a patient. So he knows what it's like on the other side of it, because he's gone through a battle with cancer. So he knows it. He knows the language. He knows how to say it. He knows how to sell it. Watch him. The problem is conservatives are allowing these think tanks to make policy suggestions. And that is a problem. These think tanks are in bed with all of the crony corporations as well. So you will not see me lined up with any of them. No think tanks at all. And if it's organized medicine, if it's an established AARP, the American Medical Association, if it's huge organizations like that, I guarantee you they are not representing the people that they say that they are representing. They have a stake in it. And so I have steered myself away from them. I am very active in my local my state medical organization. Even though that they are all, they get some of their policy, framework from the American Medical Association, but they more directly direct and control policy at the state level. So I advocate for every physician to get involved in their state medical association, just for that very reason. It's a smaller entity. And even some of the smaller, like kind of local county medical associations as well, because you can actually create legislation for your state just by having resolutions, and it actually helps you debate policy ideas as well. So you get polished with that process of it. So then what these legislators want to hear, or how to get more than a 10 minutes out of your legislator at all. And so you get that. They do have lobbyists, absolutely, and lawyers that you can bounce ideas off of. And I do that every single time I see something pop up. I text or call or email one of the lobbyists and that kind of thing. And where do we stand on this? What are we doing for this? How can I get in and meet with this person? And they, connect. And so we just have to do it. We have to be active. We can't just be on Twitter and on Facebook
I was
complaining about it. Just like you said, it needs to be about the solutions.
Yes, we have to be solutions oriented. Everybody can point out the problems, but not a lot of people. And this is a new round and a new chance to get that out here. I'm thankful for you coming onto my show today. I know you're going to be on a couple of other podcasts in the future.
Yeah.
You said you're starting your podcast. Can you let us know exactly what's the name of your podcast? And I'm going to put it in the show notes later down below.
All right. It is called Free to Care, the podcast. Free, the number 2, the word care, all in one. And it is going to air at 8 p.m. Eastern on Friday nights. This coming Friday is the first night. We are going to go. It is going to be a live show, and I hope to I'm going to introduce everybody to what the organization is, the coalition members, and each of the solutions that they bring to a specific healthcare challenge. So it is really going to be solution oriented. We're not going to be, complaining about what's going on. Well, we'll tell you what the problem is, and then this is our solution to fix it. And that's how it's going to be. Hopefully it'll be fun. I hope, and that's freetocare.org is the website. You can look at our policy positions. We do have a white paper that we wrote in 2019. We are actually currently updating and revising that one. But it does explain our positions on things and what we think are solutions to lower healthcare costs and actually give everybody access to great care and make physicians want to stay in medicine. So awesome. We can give you guys that great care. So
I know we can talk all night, but I don't want to hold you any longer from your babies, and my babies are probably making noise too. So
yeah, I'm sorry. Yeah, my doggy is.
That because people are really, really concerned when it comes to this healthcare topic, and they really are looking for solutions. We don't want to just hear that the left solutions are bad. We want some competing ideas. So I thank you so much for being on my show.
Thank you for having me.
Yes, and I thank you so much. And you have a good evening. And I'm definitely we probably going to do it again. Thank you. And thank you all for joining us in the comments. And see you next time on Miss Pinky Thoughts.
All right.